big story at this hour about the vaccines. All right. So vaccine exports and donations are going to be resuming starting October 2021. Vaccine Maitri, India's program, is basically resuming. The Union Health Minister Mansukh Mandaviya announced this, saying that in the fourth quarter, starting October 2021, India will resume its exports of vaccines under the Vaccine Maitri program, and this is basically to fulfill the commitment of India towards COVAX. COVAX is an initiative that countries are pitching in to provide vaccines to those countries which are not as privileged. He also informed that the surplus supply, that is what is being called at this point, surplus supply of vaccines will be used to fulfill our commitment towards the world for the collective fight against COVID-19. COVAX, remember, is co-led by Gavi, the Coalition of Epidemic Preparedness Innovations, and WHO as well. And information about expected production in the coming months, the Health Minister said, is said to be more than 30 crore doses that will be produced in October, and more than 100 crore in the coming quarter as well that will be produced. But just to put this story in context for you, look at this picture and this graph on your screen right now. The red line that you see, which is about 1 over 1.22 crore doses a day, is what is the required number of doses if we want to vaccinate our entire adult population by the end of this year. But where we are is a huge lag. And in middle of all of this, India getting into export again is of course going to be questioned and going to be looked at with a critical eye here in the country. Let's cut across first to Meher Pandey, my colleague, joining us with all the information on this. Meher, so the Health Minister announcing that there will be resumption of vaccine exports. Any clarity on numbers on how they are placed as of this moment?
Yes, Sona. So India will be resuming the export of vaccines under the Vaccine Maitri that was so infamous earlier on in the pandemic. It was put on hold when the second wave got really bad, and there was a lot of criticism that crucial vaccines were going abroad when people within India were not being able to get it. And now the minister has said that vaccine production is increasing and cases have fallen, so we're in a better position to be able to export again. But are we really is the real question, because he said there is a surplus of vaccines available now. But as per the Health Ministry, in October, 30 crore doses will be produced. And as per our sources, in September, 23.5 crore doses will be supplied. But according to this, this is actually below the needed rate of vaccination. The sustainable pace, according to this vaccine supply, is under 1 crore doses a day. And then if in October these optimistic production numbers that the Health Minister is giving, that both manufacturers will give 1 crore doses, will give 30 crore doses, that will just about make the needed vaccination pace. The needed pace is 1.23 crore doses a day to vaccinate fully the 60% of our population. So right now, if both manufacturers are doing as much as the government is saying they are making just enough to meet the target for our own population. So there isn't enough actually available to be exporting right now as per the ministry's own information as for October. So this is a really interesting time why they have decided to begin export again. And it's mostly to fulfill commitments to the COVAX coalition. It's an international coalition that the...
Right. Meher, could you just refresh the memory of our viewers as well as of when the export was actually stopped and why did that take place?
So it was stopped in February, early April, I believe, when the second wave was starting to get really bad, especially in Delhi, of course, in other parts of the country as well. When there was a shortage of vaccines, all of the states were running out of vaccines almost every other day, and complaints were being raised on how the vaccine drive was being handled. So at that point in time, the export was put on hold. And now, if it's too soon to start it again is the real question.
Is it too soon to start it again? That is the question. And how will the government now meet up the already existing lag in the target that India has set for itself and the numbers that we have as of this moment? That is the question that needs to be answered. Let's take it forward with our guests now. Joining us today is Dr. Sunila Garg, member of Lancet Commission COVID India Task Force. Also with us is Professor Anita Ramesh, a specialist in clinical trials as well, and her opinion also on this entire vaccine journey will be key. Let me start with you, Dr. Garg. Very simple question. The target, and if we can put out that graph again, just to put things in perspective on how numbers are stacked up, right? There is a particular number that is required if we want to achieve our target. We are already lagging at this moment in, getting back to opening up our vaccines again. How good or bad is that going to be? Dr. Garg?
Yeah, thank you so much, first of all, for having me on the show. Number one, which I like to say is that if we are only protected once our neighbors are also protected, number one. Number two is that along with the, it's not only 100% of the coverage vaccine, what we are going to require, it is also important at this juncture to look at the seropositivity. Our fourth sero survey report showed that we are having already 67.9% of the seropositivity, which plays a very, very important role in terms of naturally acquired immunity. So even if we are going to immunize about, let's say, instead of when we are talking about, 90 crore individuals more, even if we immunize 60 crore individuals, that is good enough, because natural immunity plus vaccine acquired immunity will give us, a good amount of immunity. To my mind, and as I already told you that, we are safe only when, our neighbors are also safe. Vaccine has to go, our virus has to go to the world. That is first of the most important thing what we have to remember. So it is one world, one health. We have to talk in that sense.
Right. Dr. Garg, all fair points that you're making really at this point. But then how do you look at what's happening with countries like Israel, for example? They've gone into third dose of vaccines at this point. What do you see countries like UK, where numbers are very high? Yet again, we see the numbers of COVID infections going up. Other countries as well, US as well. So how do you... Both can't be true.
Yeah, you see, you have got a very important point, because all these countries only relied on vaccine. If you remember, they gave 2 doses of vaccine. There were not many natural infections. So that's why, breakthrough infections have happened over there, and those countries are now giving the boosters as well. The same is true for UK and same is true for USA also, because those countries only relied on the vaccines. But in our country, we do have, large number of cases who have acquired infection because of the natural immunity. So vaccine is not alone the answer, because we do have infection with Delta variants and, which are also evading the immunity. So we have to keep that in mind at this juncture. COVID appropriate behavior plus natural immunity plus vaccination, these three are going to play a very, very important role.
Okay. Let me bring in Dr. Anita Ramesh at this point. Your thoughts, ma'am?
Yeah. What you said, what the discussion is going on is very relevant. And rightly the curve says we are much below what the expected vaccine rate should be. Yeah, being a doctor, yes, I will be in practice. Definitely India needs to be vaccinated. But you have to keep a thing on a global aspect. We have opened the doors for international things, and people are coming in. Indians are also going out. Yes, the world needs to be safe. But what I would like to suggest, first we should vaccinate us, Indian, and then we should go for export. And we are 94.4 crores to be vaccinated. I think almost 70 approximately crore has been. That is also one dose. Second dose has not been given. And we are talking about the third dose. See, me being a medical professional, I received my second dose in February. And I'm 6 months to 7 months down the lane. My antibody titer must have decreased, and I am quite exposed. So I need my third dose. So there is an increased need in India for the third dose for the high risk, normal individual, high risk, and healthcare workers, starting from the sanitary worker, nurses, paramedics, and doctors. So that also has to be kept in mind, and that is not included in your calculation. Third wave, or the third dose for the next group of people. So yes, the demand is high in here.
Yes.
India, we need more imports also, and more manufacturing also, and increase the production, and then you distribute to the surrounding countries. And rather
Dr.
you donate to those countries for people who want to come to India.
Hold on a second. You've made a very important point, and I want to go back to Dr. Garg on this one. It's good that we're having two doctors actually discuss this. There's no political discussion over here, right? And there are really two theories. What Dr. Garg is saying is also correct. India has made a commitment at the end of the day, and we have to fulfill that. At the same time, there are very genuine concerns, Dr. Garg, on exactly what Dr. Anita was also saying. Doctors saying, well, my immunity is at risk at the moment, and why are we not prioritizing our own people? How do you answer? Because I'm sure this is, your own doctors are going to come to you with the same question. How do you answer that?
See, one thing which I like to bring at this juncture is that we need to see that how many breakthrough infections we have had. I think almost, it's 90% of the infections have been breakthrough infections also. So we have to keep that also in mind. But as I'm telling you again and again, that basically we have got some immunity after receiving, 2 doses of vaccine. And, quite a number of us have also got natural immunity by having, officially we say that we have got about 3.4 crore individuals who have received, who have got infection. So that is one thing which you have to keep in mind. Your data already shows that we have got 80.86 crore individuals who have already been vaccinated. And we are talking of, more than 30 crore vaccinations, in the coming 3 months or so. You see, and now, we are in the midst of September. So, even if we are going to give some, let's say you see our neighboring countries like Bangladesh, or, if we talk of Bhutan, or we talk of Sri Lanka, Maldives and all that, and especially when we talk of Bangladesh and all that, if they are not protected, I am very sure that, we are also not protected. So, you see, we have to talk of one world, one health from a public health perspective.
Okay.
And as I said, that we cannot only rely on the vaccination part, that is one thing. And the second thing is that we have to see that as of now, the 2 doses are sufficient. As and when the, basically, we will need the frontline workers, will need the vaccines are going to be available. But we have to see that we obtain sufficient amount of
I have to say at this point, the question is not entirely about whether or not third dose is intended. The question is really if we need to prioritize, if this time period is okay, especially at a time when a lot of predictions have said that it is around October and the end of the year when we are expecting a third wave. A lot of calculations done by IITians have indicated that. The question is, if that is the case, should we be sort of not keeping our doses for ourselves? I know there is lots to say on this discussion and everybody has an opinion, but I'm sorry, I'm running out of time over here, so we'll return to you and we continue to track this story.